Hi, I'm Dr. Elizabeth Murray, and welcome to 292 Baby. Bumps and bruises and fevers, these are all things that parents are commonly taught to deal with. However, it turns out that sometimes there's things a little bit scarier that can happen, and we need to be ready to deal with those too. One of those more common things is actually seizures. Joining me again today is Dr. Hughes, a pediatric neurologist from Golisano Children's Hospital. Welcome back. Thanks for joining me today.
Thank you so much, Dr.
All right,
Murray.
so seizures, that's a scary term.
Absolutely, but while seizures are incredibly terrifying and they can be a very scary thing, for the most part seizures are actually relatively safe for a child to have so long as everyone involved knows what to do when a child has a seizure.
Being prepared. We always want to be prepared, right?
Absolutely.
Boy Scouts were right. Be prepared.
Absolutely. And so long as we know what to do, it's something that we can make sure that a child receives care in the right amount of time, that they are safe when they have their seizure. And so epilepsy is an incredibly common diagnosis, with epilepsy being a child or an adult who has had at least 2 seizures in their life and has a propensity to have more. With that diagnosis, 1 in 26 Americans is diagnosed with epilepsy at some point in their life, with childhood onset being a very common thing for most epilepsy syndromes, but many children can also outgrow their seizures. So in the end...
And I think too, something I see in the emergency department a lot is seizures in the setting of fevers. We call them febrile seizures, and that doesn't really mean the child has a seizure disorder.
That's
Sometimes they
true.
can just do it and never again.
Yep, and so many infants, actually about 1 in 30 to 1 in 50 infants will have a febrile seizure in their lifetime, and may even have a few of them, but again, that doesn't necessarily mean that they truly carry a diagnosis of epilepsy. That's something that over time will be determined depending on how the child does.
Right.
Importantly, because in addition, those are actually kids who will have seizures in addition to kids with a diagnosis of epilepsy. Seizures themselves are incredibly common. And so also we all know that seizures can also be the outcome of many things, so things that they were exposed to, so toxins and poisons.
Yep.
We're
finishing up toxin week.
Absolutely.
So be aware of the things in our home.
Absolutely. We also know that injuries can lead to be associated with seizures. And while we want to make sure that the child is safe from the standpoint of all of the other things that could have contributed to the seizure that they may be having right now, we also want to make sure that the seizure, that everyone knows what to do just in case of a seizure itself. And so the very first thing to do is the most important thing to do in all kinds of emergency situations, and is the hardest one there is: don't panic.
Right, staying calm, because your child is sick. I always say seizures are much harder on the parent than it is actually on the child, because you're watching your child go through something that seems horrifying.
Absolutely, and so the first thing to do is to try not to panic. It's going to be hard to do. I've seen thousands of seizures at this point. They scare the pants off of me every time.
Sure.
But because I know what to do, I know that I can just go through a set of steps in my head of what to do next if the child has a seizure. So the very first thing to do is don't panic, and to make the child be safe. So if the child is stiffening and beginning to fall, if the child is starting to shake, the very first thing to do is to get them to a safe place so that they're not going to fall off of anything, fall into anything. We want to try to get them to the ground so that they will be in as safe a location as we can. Give them space, make sure that there's nothing poking or prodding or hurting them that they can injure themselves on. We also then want to see if we can roll them to the side if it's safe, because
it's very common to do the drooling, and we always say, and they were frothing at the mouth. Well,
exactly, and some kids will also, after the seizure is over, or sometimes even the course of the seizure, vomit.
Right.
And so we want to make sure that that goes out and not in as much as possible, and having them on their side can help with that. The next thing we want to do is the next scariest thing, which is wait. We want to actually have someone start to time as long as the seizure is happening.
Because no matter what, it's going to feel like it's going on for hours, and so it's really hard to judge the time.
The majority of seizures, so 80% of seizures are or more, last less than 2 minutes, but they do feel like an eternity while they're occurring. And so that kind of information of how long the seizure truly lasted is going to be very important for determining the next steps for care, and is also going to be very important for the next thing, which is whether or not you're going to call 911 for the seizure.
Okay. Before we move on to that, I just want to quick touch on 2 big myths. One is that people feel like if they could just hold the child down, that'll help, and then the other thing is people worry about the patient swallowing their tongue.
Absolutely. And so first of all, do not hold the child down. Most likely you're going to get injured or hurt, or the child is going to get injured or hurt.
Sure.
Clearing the area and making sure that they're safe is the thing that you want to do. The other is that you can't swallow your own tongue. Thankfully, tongues are built so that you can't swallow your own tongue.
That's right.
You can injure your tongue, and biting of the tongue or biting of the cheek is actually very common in epilepsy and in seizures, and is something that we can secondarily treat. But trying to grab a tongue, trying to put something in someone's mouth, that actually just increases the risk that the person who's trying to help is going to get bitten or harmed. It also increases the risk of broken teeth. It increases the risk that you're actually going to aspirate something, for instance, wooden spoons or a very old wives' tale. Don't do that.
Don't do it. Don't do it. Okay, so now you've waited and you decide, all right, am I calling 911 or not? I think in general, if it is the first time this is happening, your emotions are going to be running so high. I usually recommend go ahead, call 911.
Absolutely, and that's never wrong. If
Correct.
you're in a situation where you're not sure what to do, ask the professionals to come and help. In the meantime, while you are waiting for them, the things that you actually want to do are observe. It doesn't help us when a family arrives to the emergency room to use those words that everyone throws about, petit mal, grand mal.
Right.
Those don't actually help to explain what happened. It helps if you can say, he stared, he became stiff, he fell to the ground, and both sides of his body were shaking, or only one side of the body was shaking, or maybe it was just staring or twitching. Each of those little details can actually be of great help to the emergency room. It can be of great help to the neurologist to understand where the seizure started in the brain, where it spread to, and can also give us clues on how best to treat it. And because of that, that actually, in the greater scheme of things, is one of the most helpful things that families can do. For kids with a diagnosis of epilepsy, if they've actually had multiple seizures like this, and the seizures we know last long, so greater than about 3 to 5 minutes, we often want to treat to make that seizure stop.
Okay.
The seizures themselves, because they are relatively shortly lived, don't necessarily cause a harm. They don't cause brain damage when they're occurring. They can.
And that's, I think it's important to remember too about febrile seizures, seizures in the setting of a fever. It's not that the child's brain got so hot that they're seizing. It's just that person is kind of set in a different way, if you will.
Absolutely, and there's a difference in their brain chemistry that allows them to handle their electricity a little bit differently in the setting of that high temperature that leads to the seizure. And so as long as the seizure is not long, lasting longer than the 10 to 30-minute range, as long as the person is able to get oxygen, and not necessarily oxygen cannula or by us giving them oxygen, but is able to move their air and keep breathing, then they are safe from that seizure occurring, and we have time to kind of work on getting them supports. And so if a seizure is going on over about 5 minutes or so, and that's kind of persistent for the patient, we want to work on stopping that seizure so it doesn't get to that point where they are not having as much oxygen as they need, where they might be having a difference in how their heart rate is managed.
And so at that time, I mean, that's a time where certainly your pediatrician is going to be involved in helping it out. We don't expect parents on their own to be navigating these waters, right?
Absolutely not. And so if the seizure is going longer, then EMS should certainly be on their way. If the seizure is going longer and this is a kid with a known history of epilepsy, very often they will have a rescue plan in place. And so the timely utilization of those rescue medications that are given by the pediatrician or given by the doctor, so often Diastat, sometimes clonazepam, sometimes lorazepam, they're medicines that have that PAM to the end of them, are medicines that we can use to acutely stop a seizure if it's going on for a long time, or if a child has kind of back-to-back very small seizures that kind of are clustering and causing a problem for the kids' ability to interact and ability to do the things that they need to do.
Okay, but what you're talking about there is kind of more of the extreme situation, I think. So kind of wrapping this all up for us, from my perspective, you know, we will see children who are going to have a seizure. They might just do it once and never again. At home, if that's happening, we always want to make sure that the child and then the people around them are safe. This is totally an appropriate time to use 911, really regardless of the acute medical condition. We don't ever want a family driving a really sick child in, because then they're just a distracted driver, and so that's another safety issue. And then sometimes these seizures need treatment and sometimes they don't, and we all agree much harder on the parents to deal with than the child. Is there other little pieces of information you give families with regards to, are there good resources out there, a good website that you'd like to suggest?
Absolutely. So the Epilepsy Therapy Project is a collaboration with the Epilepsy Foundation and Epilepsy Therapy Project. It's epilepsy.com. It is a wonderful resource for families who have questions about seizures, who want to learn information about seizure rescue plans and how to make sure that each child has an appropriate plan if they have a diagnosis of epilepsy with longer seizures. And it's actually also a very good source of information for things about febrile seizures and other diagnoses as well.
Great. As always, thank you for joining us, and thank you for joining us on 292 Baby.